Good. Let's do quadriceps, in slang known as the quads. If you do your Latin, quad means four. There are four muscles in here. The most superficial is rectus femoris, and then vastus medialis, vastus lateralis, and then deep to rectus femoris is vastus intermedius. Rectus femoris begins on the iliac portion of the acetabulum, which is out here. Its primary function, all four heads of the quad, their primary function is extension of the knee. Bend, that's flexion of the knee, that's extension of the knee. Their secondary function is flexion of the hip. So the glutes and hamstrings do extension of the hip, which is going back, and they do flexion of the knee. The quads do flexion of the hip and extension of the knee. So they are antagonistic. From the iliac portion of the acetabulum, rectus femoris comes all the way down. This is another muscle that has a common insertion. Some textbooks call it the quadricep tendon, others call it the patellar tendon. I don't really care what you call it, but they come together. All four heads will come together and form what I usually refer to as the patellar tendon, which crosses the patella and it attaches right in here. So insertion, origin, you contract that muscle together, it does that, it also does that. Vastus lateralis is a knee extender. It doesn't cross the hip joint, so it doesn't do hip extension. Mostly just rectus femoris does that. Vastus lateralis begins on the greater trochanter and the linea aspera of the femur. So right in here. And it comes down on the lateral side of the leg, hence its name, vastus lateralis, into the patellar tendon. Vastus medialis begins on the superior and medial femur, right in here, and attaches onto the patellar or quadricep tendon. Vastus intermedius is deep, so if I was to dissect her and take the rectus femoris off, the next muscle down is vastus intermedius. It begins on the anterior femur, so right in the front, the upper third part of the anterior femur, and attaches via the patellar or quadricep tendon. And we've also got sartorius. Which begins out here. Sartorius flexes and abducts the hip. It's also a weak lateral rotator. Okay? So sartorius begins up here, the anterior superior iliac spine, right there, and attaches down on the pes anserinus like that. So it crosses the leg. Gracilis runs like that, sartorius runs like that. They are all knee flexors. Sartorius also does abduction and lateral rotation. One muscle that we'll talk about in the lower compartment, as long as I'm getting. We'll do more of these in one of the next videos. This is tibialis anterior. It is a dorsiflexor, and it also supinates the foot. So it begins on the anterior superior tibia, inserts on the medial cuneiform and the first metatarsal of the foot. quad work. I usually will do active and passive range of motion. So I'm going to strip that while I'm stretching it. Again, this is a big muscle. If you're not comfortable using your hands, you certainly don't want to use your thumbs and fingers in here. It's not a fair fight. Use both hands. Use your elbows, okay? Most people, if they're athletes, really like deep pressure in the quads. Maybe not as much as they like it in the hamstrings, but they're going to like deeper pressure because that's how you can, without going into pain, it's going to require you to use some pressure in order to break up some of those myofascial adhesions. Again, pre-event sports massage would be nice and quick, loose, just trying to get all these muscles loosened up all the way down into the calf, and we'll do more in the calf later. Okay? Passive range of motion for quads is I'm just going to bring her foot as close to her bottom as I can. She's going to tell me to stop. No good? Okay. Too much in the knee? Okay. So she has a pre-existing knee condition, which is going to make this a little bit more complicated. What I'm going to do is I'm going to avoid aggravating that, and I'm just going to take her into a deep stretch. And then, again, this is not terrific body mechanics. There's a much better way to do this, but I want you to be able to see what I'm doing. I'm going to have her lift up into my hand. 3, 2, 1. As she relaxes, I'm going to continue to stretch her until she says stop. Okay? You can also do that with internal rotation. You can do it with external rotation to get the different heads of the quads. Tibialis anterior is a dorsiflexor, so to stretch that, we're going to take the foot this way into plantar flexion. Hold your foot for me right here. Hold. Okay? You can see that muscle fire right there. That's tibialis anterior. Big, powerful muscle right out there in the front.